Welcome to a walkthrough of the new features added to SimHERA in version 3.0. There are many new features in SimHERA, one being the Simulated Human Behavioral Audiometry, or SimHBA for short. Also included in SimHERA version 3.0 are Auditory Steady-State Response module. So let's get started and showing you some of these new features. There have been some rearrangements of some of the panels. We still have our open mode, assignments, and final exam. We set up our patient here in this panel. It now presents us in 2 dimensions, or we can select a 3-dimensional head and we can rotate it, or the 2-dimensional views. This helps for those computers that have lower end graphic processors and won't take up all of their GPU processing. And we can select between left view, right, top, and back. The auto apply function is still there, and now it will be there for assignments, again to help those with computers with lower end graphics. And we have a female patient set, so we have a nice female 3-dimensional head. We can do tympanometry, acoustic reflexes. Let's wake up this patient. Tympanometry, acoustic reflexes, and OAEs. We'll come back to those in a moment. We can randomize for infant cases, adult cases, just like before, and if you're an instructor and have the instructor version, you can turn on and off features just as you did in the earlier versions of SimHERA. We are able to load the cases and save the cases. Also included in the new features is this auto save function, so we don't lose our hard work, so it'll automatically save every 10 minutes. That's what's set here. You can set this to any time. If you want to update sooner, set it to 5. We also have this function called patient-centric view. So when we're doing evoked response audiometry, which I'll click on this tab here, currently the right channel now is on our left, so it's in patient-centric view. We can change that and make it tester-centric, so now left channel is on the left. So this helps us to equate the channel side when we're looking at behavioral testing as well as evoked response testing. Just like before, we can change our font size to make it a little bit more accessible if we want a larger font size. And to go back, let's just divide that by its scaling factor. Also changed around a few things here where initials, age and months, case ID. This is genetic sex, male and female settings. We have a test date and birth date. This is the file information when you're recording the evoked responses. But we'll move on to the different panels. Before we had a panel that would pop up for the audiogram. Now we have this situated under simulate case. So this is where you're going to be simulating the information of that case. Instructors can do this manually, or we can also set this randomly. So random assignment, just click on the buttons here that will randomly assign them as a case for typical hearing, conductive hearing loss, sensorineural hearing loss, auditory neuropathy spectrum disorder, and retrocochlear pathologies. The thresholds are now set as true thresholds for an extended frequency range from 125 Hertz all the way up to 20,000 Hertz. There's also a pure tone average for the 500, 1000, and 2000 Hertz calculated here. So these are the AC thresholds for left and right ears, and the bone conducted thresholds for left and right ear. And then the ANSD percentage down here. Included now in the behavioral response audiometry, so the behavioral testing, we have our psychometrics. Response probability versus sensation level, and we can make this to be quite reliable patient where they will respond in a very narrow range of sensation level, or a very unreliable patient where they are responding over a very large range of sensation level. The other aspect is this standard deviation of threshold from a presentation to presentation. So if we're doing behavioral audiometry, if we're presenting a stimulus, sometimes the threshold might be a little bit higher or a little bit lower than the true threshold, and this is due to attention or swallowing, bodily movements, maybe even some external noise that would enter into the sound booth. So we can model that and mimic that here. We can make it stable across the recording session, or we can allow it to fluctuate, and we can change the amount of standard deviation we have as it fluctuates across the session. ABR wave latencies are the same as the earlier versions, so I won't go into that. We have our audiogram. We can change that to dB/NHL. This is for ABR versus our dB/HL values here. So that summarizes the kind of the new features in the Simulate Case tab. We also have a Case Report tab. I will come back to this because we'll introduce behavioral audiometry here. So this is the SimHBA. Now SimHBA we have set up here as a patient within the booth. If you want to see features included in SimHBA, check out the link above, and there's a video tutorial on that. So I'm going to go over this very briefly. You can present stimuli through insert earphones, supraoral, bone conductors. It will present psychometrics. We have the audiometer down here in similar format to some of the clinical systems. We have stimulus playback. We can present tones. We can do live recordings for speech, as well as pre-recorded word lists that we can change down here, and the patient will respond accordingly. We can set in masking, both left and right masking, broadband, and we can present stimuli at different levels with a warble tone. Probably can't hear that. Let's turn this up. And we have a warble tone being presented, and clearly the person could hear it. We can store that threshold, in this case it was a bone on the right, onto the audiograms. We can do speech recognition thresholds, word recognition scores, and add those into here. This also presents true thresholds when you're in that open training mode, and you can see how well you did at estimating the true thresholds of this patient. So that's a brief overview of what SimHBA can do. Again, check out the tutorial on SimHBA. We'll move into evoked responses. The same ABR testing can be done in version 3.0 as what you've done previously. There have been some minor tweaks. Check out the new updates listed on the SimHERA website. We can do MLR, CAPs, and the new version is that we can do auditory steady-state responses. So click on auditory steady-state responses and the auditory steady-state response module comes up. Currently we have dichotic stimuli, so these are the stimulus waveforms for the right ear and for the left ear, and we are putting in 4 different stimuli. So these are amplitude modulated stimuli as set by the stimulus parameters down here at the bottom for the right ear and the left ear. So we can see that we have a 500 Hertz carrier frequency modulated at about 80 Hertz. It is an AM. We can select that between AM modulation or AM squared modulation. It has a modulation depth of 100, but we can change that down to be even lower, and it instantly changes the stimulus, as you can see up here. As well as this is the FFT of that, so we can see how the spectral splatter occurs by changing different parameters here down on the stimuli at the bottom. This is the FM width or range. So we have 10% range, 20, so on and so forth, and that is going to spread out the frequency. As you can see, it changes here. So we can set this to have AM/FM stimuli being presented. If you want to just use a standard one, there are different settings here for dichotic multiple. This is monodic multiple for left ear, right ear, and monodic single, left ear 2000 Hertz and right ear 2000 Hertz. But we can always set this to dichotic multiple, and we can turn on and off the stimuli as we wish. So let's have a listen to this dichotic multiple stimuli. And keep in mind, whenever we're listening to stimuli using SimHERA, we need to make sure that our speakers are set at safety limits. So make sure that they are at a comfortable listening level and do not exceed those safety limits of hearing. So you can hear the roughness of those AM tones being presented in both ears. So once these are set, we can actually go and record if we like, but we can set our dB/HL levels, the number of epochs per sweep. So this is going to be the number of epochs that get averaged together to do the FFT, concatenated really and then averaged together. And then the number of accepted sweeps. So this follows the master software program that was in the earlier biologic systems, and it's modeled similarly to that. So that we use 16 epochs per sweep, but you can change this anywhere between 12 and up. And then the number of sweeps is default at 48, but if you wish to use 36, even 24, if you got a very, very quiet patient, you can set that as there, and then it'll automatically stop after that. We can acquire online, but we can also acquire offline, just like you did for the ABR or the other evoked responses, and there's also a clamped tube option here. We can set our DBNHL or DBHL values, I've said there. Now let's go ahead and acquire a recording, but first we need to make sure that our patient is set up, and yes, she is. She's nicely set up with inserts in. And let's check our EEG. We've got a nice EEG. Let's bring down our artifact rejection limits here, and we can see that moving just nicely. A little bit noisy, but okay. So let's go ahead and start an acquisition. So we'll acquire. The new feature is that the session doesn't start until we click the start sessions. In the assignment modes, this will allow for those users who have a slightly slower processor to set up the patient. So this is a new feature. It allows you to start the session once you've set up the patient. So we'll go ahead and start session and acquire. And what you'll see is the collecting epochs. Nothing is showing up on screen until those 16 epochs per sweep are collected, and then the calculation of the FFT takes place. There we have the first sweep being accepted and collected. Total epochs here, and the number of rejects are 0 because we're within our artifact rejection. This is the FFT displayed within the range of frequencies of those being tested, so between around 80 to 100 Hertz, but we can turn that off so we can see the full spectrum if we like. We can also change this to auto scaling the y-axis, so now this won't auto scale. You'll start seeing the noise floor drop as the number of sweeps get averaged together. And we can see the different modulation frequencies here for the different stimuli. They're labeled as 1, 2, and 3, corresponding to the stimulus 1, 2, and 3, 5, 6, 7, and 8. And this is for the right channel and the left channel. Like I said earlier, we can make this patient-centric, or we can change this to be tester-centric. So now the left channel is on the left and the right is on the right. We'll flip that back to right channel. What we have down here are the data from the FFT. So this is the stimulus 500 Hertz, modulated at 80 per second at 50 dBHL. And this is the response amplitude in nanovolts, the response phase in milliseconds, the side bin noise. So you can see how there's a slight shading going on here, and that will give you the average value within those bins. So you can estimate the noise level to determine when you'd like to stop, and the p-value of the F statistic for both left channel and right channel for this stimulus. Even though it's under the right channel, it's listing for this stimulus the left channel. So if we went to stimulus 5 here, this is the right channel recording is 48, and the left channel over here is 49 nanovolts. Now if we want to switch back to the stimulus waveforms, what we have up in the top right is an ongoing collection of that data, so you can still visualize what's going on as these epochs and sweeps are being collected. And again, we have that same frequency, amplitude, noise, and p-value here. The box will turn green when it's less than our set threshold of 0.05. And we can see that they're all green, which means responses are present. Now to note, the physiology behind the steady-state responses are actually based on the auditory filter models of Glassberg and Moore. So there are effects of masking going on due to upward spread of masking as well as just tone-on-tone masking. Therefore, you can show about masking and how we have these interactions going on within the cochlea when we put in multiple stimuli. What I'm going to do is just stop here. We'll say we've collected 20 sweeps, and we'll go ahead and do a collection offline to demonstrate our averaging methods here. So you can see that we've got nice large responses and very low noise floor. That's because we have a collection of 48 accepted sweeps. But let's say we wanted to really bring down that noise floor. We can select these two, click on the average, and there we go. We have an average of those two recordings. We can also subtract and multiply just like we did for our other evoked response modules. Just like with the evoked response modules, the other ones, we can also do masking. So we have right ear masking and left ear masking, and we can set those levels. And this simulates both crossover masking as well as crossover stimulation. As we can see here, we have responses in the right channel for the left stimuli, and we have responses in the left channel for the left stimuli. So it looks at both the stimulus crossover as well as masking crossover. It also does bone conduction. So this is a bit of the change in the new setup, that if you want to do bone conduction, we go back into the patient setup and we can select the different transducers here. We can select none. We can select inserts. If we select inserts, don't forget to insert them. We can also choose headphones. So these are the supraoral headphones, and we can do bone on left. So if it's in 2 dimensions, it looks like the bone oscillator is actually situated in front of the ear, but in reality it is actually situated behind the ear. All right, let's move to the reporting of all of this. We can then report out based on our case. Here on the case report, there's a history. We can type in a history of this patient. This says it was a newborn. Actually, we have to update it because I changed the age. So this was referral from medical doctor ... Okay, so you can add in your history. The behavioral audiogram gets updated based on the behavioral audiogram that you're setting in the SimHBA module. Also gets updated is the speech audiometry, and we can do otoacoustic emissions now. So if we click back here and we select DPOAs, I'm just going to move this. You can click here and drag it over. And for those who have slightly lower processors or GPUs, you can click up here and resize it. That usually helps the processor speed a bit. Gives it a little bit of a benefit there. And you can see that we've been updating every 10 minutes for the autosave. So with the DPOEs, what we can do is, let's just do a DP right ear. Select that, probe goes in right ear. And you can see the DPogram being created. The norm values are in the shaded gray, the noise floor is in the shaded color, and the DP values are in the circles. And we could do that also for the left ear. But I'll just show that we can also do tympanometry just like before. So temp right, as well as temp left. What you might have noticed is it automatically updates in the case report seen here. It also updates the table about the different measures of the admittance that you just collected. I'm just going to set that to 0 to turn off auto saving. We can also do acoustic reflexes. Just to demonstrate that, we'll just do one for the right ear IPSI. So this is a right ear stimulation with a right ear recording. And for this individual, we got 80, 85 reflex, 95, and 100 there. So we can set within this table, right ear reflex, we said was 85. So we type in 85 and it instantly shows up in the case report, and that was for 500. We can change the different frequencies here. We can set that to auto, or we can set it to manual. And if you wanted to do 105, we can just boom, 105 there. This is also the AR signal, so if we were not sure about that 85 one, we can see the green line underneath is the true response or reflex, and we can see that there was a reflex there. We can also do the right ear stimulation with a contra left ear recording, as well as doing contra decay, right ear and left ear. So that is the tympanometry, acoustic reflex, and DPOEs that we can do in the new SimHERA version 3.0. The case report also allows us for updating or reporting out our evoked response results. So neurological, if we'd done a neurological ABR or any other types of testing, we can enter in the report here. We can say wave, if we did this, wave 1 to 5 within normal limits, and then whatever else you want to report on. We can add in the thresholds here and designate what they are based off of. So if we did slow corticals, we could say our 500 Hertz AC thresholds were less than or equal to 20. And then add that in. We can include our summary of our findings as well as our recommendations. And then save this report. That report could be saved, it saves out as an image file, which then can be transmitted to the instructor. Or when you do your saving of cases, all of this information gets saved so that when the instructor loads it back in, this information will be there. So that summarizes the new features, most of the new features that we have included in SimHERA version 3.0. There are some bug fixes from previous versions and some little bit of added features here and there. I hope you enjoy the new version of SimHERA version 3.0 and have fun learning.